Welcome to Public Health Ideas. I'm Sandro Galea. I serve as Dean of the School of Public Health at Washington University. These are conversations that aim to highlight work that's relevant to public health from faculty across WashU. I will be speaking with members of the faculty about their work, focusing on recent papers that are advancing the science of health. Today, I have the privilege of speaking with Professors Rachel Tabak and Sarah Ferabi. Dr. Tabak is Associate Professor at Washington University Brown School of Social Work. Dr. Ferabi is Assistant Professor of Nursing at Goldfarb School of Nursing and a Voluntary Research Assistant Professor of Medicine at WashU School of Medicine. We're going to be discussing their paper in Women's Health Reports, Sleep, Stress, and Cardiometabolic Health in Women of Childbearing Age with Overweight and Obesity. Welcome. Thank you for being here.
Thanks for having us.
So let's start with where the research comes from. What led you to start this research? How did the study come about? What knowledge gaps were you hoping to fill?
So I'm trying to identify strategies to improve sleep health in populations across the lifespan, but I am particularly interested in trying to improve sleep health in women of childbearing age. So we know that at least 40% of women of childbearing age report poor sleep health, and that means that either they don't sleep long enough, they wake up a lot, so their sleep is very disturbed, or they have a sleep disorder like sleep apnea or insomnia. And we also know that disparities exist in sleep health, and those disparities have not been well studied in women of childbearing age. So I was particularly interested in studying sleep health, and one of the things that is concerning about that is that sleep health is increasingly linked to diseases like diabetes, cardiovascular disease, and it's actually one of the Life's Essential 8 from the American Heart Association, so it's very essential for sleep health. So I was excited by the opportunity to work with Rachel to analyze some data in women of childbearing age, and that's so I started talking to her about existing data that she had, and she told me about this study.
So let's actually talk about the women engaged with the study. Tell us a little bit about the population and what are the key drivers of stress in this population?
Sure. So the data that Sarah used in her analysis is from baseline data as part of a cluster randomized trial. The overall trial is testing an intervention that embeds healthy eating and physical activity into the Parents as Teachers program. Parents as Teachers is a great partner that we've worked with over the last 10 years or more. Actually, Deborah Hirjashu, also in the School of Public Health, has worked with them for decades. We work with Parents as Teachers National Center, which is a nonprofit organization dedicated to advancing early childhood development and family well-being through their home visiting program. And as part of Parents as Teachers, trained professionals and caregivers equip parents and caregivers with the knowledge resources needed to support their children's learning, development, and health from birth until kindergarten. And so as part of this study, it was mothers that were engaged in the Parents as Teachers program. We measured at our baseline some of the factors that Sarah was interested in, including sleep and stress.
And geographically, these mothers are?
Yes, the trial was conducted with Parents as Teachers sites across the country, so they're very geographically diverse, more than 20 states represented. And what the partnership with Parents as Teachers allows is to reach a really expansive group of mothers because we're able to leverage the expertise that parent educators have in meeting mothers where they are and in the trusting relationship they're able to build with those families.
And I was excited by this opportunity because really obviously you sleep in your home, and so it was interesting to me to be able to access a population that isn't typically studied as much or isn't able to participate in research studies. So we really don't understand sleep health in women of childbearing age, particularly those that come from lower socioeconomic status and racially and ethnically diverse samples.
So that leads us nicely into the next question. And so tell us a little bit about the analysis and what you found, and in particular, were there differences in degrees of sleep disturbance across groups and why?
Mm-hmm. So we studied 276 women, completed baseline surveys, and so actually 46% of the women identified as Hispanic or Latino, and over 80% of the women identified that they received assistance from an assistance program like Supplemental Nutrition Assistance Program or Women's Infants and Children. And what we found was overall their sleep we measured with questionnaires. So there was one question about sleep duration and then about seven questions asking about different factors that might disturb their sleep. And what we found was that across the board, women reported on average less than 7 hours of sleep per night, which is less than what's recommended by the Sleep Research Foundation and American Academy for Sleep Medicine, which is 7 to 9 hours of sleep. And overall, both groups had moderate sleep disturbance levels, but women who identified as as Hispanic or Latino actually had higher sleep disturbance as compared to women who identified as not Hispanic or Latino. And interestingly, when we looked at different factors that might be associated with sleep duration and sleep disturbance, we found that in the women who identified as non-Hispanic or Hispanic or Latino, there was a correlation between BMI and sleep disturbance. So although they were reporting less sleep disturbance, it was correlated with their cardiometabolic health as we measured it using BMI.
Was any of this surprising?
It's not surprising, I don't think. Well, I guess the correlation between sleep disturbance and BMI is not surprising. I was surprised that it was only, or we were surprised that it was only within the women that identified as Hispanic or Latino. And so it suggests potentially that there's different drivers of, that sleep is maybe more related to cardiometabolic health in women who identify as Hispanic or Latino, but this was a small cross-sectional study, so we'd need to do much more research to really, truly understand those relationships.
So what does all this mean? What are implications of this work? How does one actually take this to create a better context for sleep for women across all populations?
Well, one thing we also found in the study was that stress, that self-reported stress was also correlated, unsurprisingly, with sleep. So we know that sleep is, if you have high stress levels, you don't sleep well, which then probably it's a bidirectional relationship. You don't sleep well, and then you have higher stress levels. But stress was also related to unmet basic needs as well. So I am very interested in understanding how we can develop more targeted strategies to improve sleep health. So really understanding the different contextual factors that drive poor sleep health in this population, because I think our current strategies just aren't really working. And so I think that what this suggests is it was a hypothesis generating study. So we need more studies to really understand, or more research to better understand the factors that are related. So not only just stress levels and basic needs, but also in-home and neighborhood context, so social determinants of health and how those factors are related to poor sleep in women of childbearing age.
Sure. I think while this is a cross-sectional study and it's hard to draw any causal conclusions from that, I think we do understand that there are a lot of drivers of both stress and poor sleep. And we found in some of our qualitative work as well that programs like Parents as Teachers are able to really understand the social needs and social determinants of a family's context. And they're able to build a trusting relationship where they can really hear about and understand the family's situation and work with that family to try to address those needs. And so when we think about the kinds of interventions that may improve cardiovascular health down the line and sleep down the line, we can think about these kinds of interventions where a community partner is able to really understand and help a family maybe even reduce stress overall by helping them meet some of those needs, like something like food security that was reported, food insecurity was reported in a good percentage of the families that were in this study.
So where does this go? What are the next questions that you want to ask or that the field should ask?
Well, personally, I have a lot of questions, but I would like to, I just submitted a supplement to better study more in-depth sleep in an ongoing trial that we have in partnership with Parents as Teachers. It's called Enrich. It's a multi-site national consortium, thank you. And so I would like to study using more objective markers of sleep in that I propose to study sleep in a subset of the women to identify to really characterize their sleep, and then also to look at social determinants of health using GIS tools, so Geographic Informational System tools, and really characterize their associations to that would then lead to development of an intervention to target factors that are in the neighborhood or in their home even too. So I think we assume that people sleep in a certain way, but I think that especially in a lot of families, that's not the case. And so I think the next step is to really understand how those factors are related to poor sleep.
Rachel, how about you? Where does this take you?
I think it adds to sort of the need to think about health holistically, not think just about health as something that happens at the doctor, but that it's really influenced by all of the different factors in a person's life, and working with an organization or partners that are able to really understand a person's full context and work within that, I think offers a really wonderful opportunity to be able to improve population health.
And I think to that extent, it's also, all of the work that we've done with parents as teachers has really shown how that trust and that those educators have, that the home visitors have and are able to build, really is so important in not just helping to achieve parents as teachers' mission of developing families, but also to help them achieve better health outcomes. And so I think it's been a great organization to work with, and we're excited to continue to partner with them.
Thank you. Thank you for the work you're doing. Thank you for having the conversation. Thank you everybody for joining us.